So, for the exam, week from today, you need to go through digestive and metabolism. Go through all of it. Don't focus on just trying to, do digestive and then moving on to metabolism. Spread your efforts. Those tend to produce the better scores. The more you go through all of the material, the better the score than trying to memorize a section before moving to the next section. Okay. STEM Center, Open Lab, those will help. When you're looking at models, you're looking at digestive tract, it'll help you learn. When you're looking at slides, it'll help you learn, each level or each unique tissue in there. Okay. So here at the A&F campus on Friday, it's open 9 to 2 and Monday 1 to 4. And for the Lawrenceville campus, they have the times posted in the announcement, okay, on Blackboard. You will also, reminder, the test is in person. So next Wednesday, you must all be here, room 110, be on time, okay? I have a class after this, so I have to run as soon as the time is up. So make sure you're on time and you have your green Scantron. So you can get them online or you can get them, there is like a vending machine here on campus somewhere that you can buy them from, okay? So make sure you have a Scantron as well. Make sure it's not all bent up or it doesn't like to go through the machine and it's a nightmare. All right. So let's go ahead and get our PowerPoint pulled up. I believe, if memory serves right, we're around slide 68. Yeah, we were about to talk about minerals. Okay. There it is, WebEx. There we go. Share, PowerPoint, share, and we'll make it full screen. And let's get the chat in case anyone needs to comment. Cool. All right. So minerals, a lot of our food is going to be fortified with these minerals. They add it to different things. Westernized diet, you typically do not see anomalies in this, just like your vitamins. Typically with the westernized diet, you don't see anomalies. We get what we need. Now, that being said, some people have like genetic issues that are going to alter this, or they're on medications that are going to alter this. So they are important. We check them all the time when you do blood work to make sure levels are appropriate. If someone has kidney failure, for example, they're not going to secrete sodium like they should. So sodium will build up in their bloodstream. That's why we have to do like dialysis. So it is important. So sodium creates osmotic pressure with albumin, nerve conduction. So osmotic pressure, remember, is that pulling of water towards itself. Okay. And potassium, huge for nerves. So when we talk about heart, if your potassium is ever so slightly off, things go wild. Okay. They can have arrhythmias. Giving a patient too much potassium actually kills them, stops the heart. That's what lethal injection is. So you got to be very, very careful when you talk about potassium. You can't just willy-nilly give potassium. I have a heart condition. I'll talk to you guys about it when we get into heart. It's SVT, supraventricular tachycardia. It goes too fast. But we'll talk about that. And when I went to the cardiologist, and my potassium was like 4.2. And I think the range is 3.5 milligrams per deciliter to 5. And he's like, I want to see you close to 5. Wanted me to be up there because it's like better conduction, better response, so I don't go into one of those situations again. But yeah, your body regulates this pretty tightly. Calcium, we need it for bones, we need it for nerves, we need it for release of vesicles, for neurotransmitters, clotting, to create the clotting cascade, and we'll look at that. So calcium is another very important one, also very regulated. Unless you have a patient with some type of osteoporosis or a tumor that's affecting PTH in the pituitary, You don't really see alterations in this, okay? Oops. So the next one is iron. Iron crucially important for creating hemoglobin. If you're in iron anemia, you're not going to carry oxygen like you should. You're not going to oxygenate tissue like you should. So, like, we see fatigue because they're not making ATP like they should. We see they're winded. Just all kinds of symptoms, accelerated heart rate. They could increase the number of blood cells to try and compensate for it. So we can see a variety of things. Women tend to be iron deficient. If a woman is having a normal menstrual cycle, they tend to be iron deficient because of the loss of blood. And so that's why you see, like, in a woman's daily vitamin, there's iron in it. In a men's, there is not. Men should never just take iron willy-nilly. It's pretty rare for a male to be iron deficient. If they are, we need to investigate and find out why. Something isn't right. They could have like a GI bleed. They could have some tumor, something wild going on, causing that. Okay. And then phosphorus, we need that to generate ATP. That's that inorganic phosphate group that we're going to stick onto ADP to make ATP. Iodine, as far as iodine goes, crucial for creating thyroid hormone, T3, T4. If you don't have iodine in your diet, you'll develop what's called goiter and hypothyroidism. The thyroid will become enlarged because it cannot export and generate T3, T4, which are the thyroid hormones. It's pretty neat how they discovered it. It was the nomads in the desert. The guys would like migrate from oasis to oasis, and they had no iodine in their diets, and they all had hypothyroidism and these giant goiters. So that's why you find iodine in your salt. You should be buying iodinized salt. Don't buy the other salt. Okay. The other salt is for, I think it's for like when you're making pickles. I think that's it. I don't know how I went down a rabbit hole like yesterday and was looking up how to make pickles. Don't ask, okay? And I saw in the recipe to use non-iodinized salt. I don't know why. Oh, because I was thinking about making fried chicken. Because I can do that because my LDL is so low. So I was going to soak it in the brine, like how like Chick-fil-A does. I like to cook. That's what I do in my free time. Okay. Yeah. That or play Halo. It's one of the two. Video game. See? That child at heart, right? All right. Magnesium. This does play minor roles, when you talk about in calcium absorption, calcium function. So you can see muscle twitching, magnesium is off. You could see technically arrhythmias, but that's another one that's pretty darn controlled. Okay. Trace elements. These you should not supplement. You really should not be supplementing these. These elements, when you talk about some of these, they're like heavy metals, stuff like that. They actually accumulate in the body. They can obstruct the kidney, for example, damage the kidney. So we shouldn't be really consuming these in excess amount. Zinc, really the only purpose for zinc is blocking nasal receptors against the cold. So Zicam actually works. If you have the cold, you come near someone with the cold, that nasal spray, it's zinc, it binds the receptor, virus can't enter. So if you have the cold, it can decrease the length of the cold, and it can actually stop you from catching the common cold. That being said, for most of you at our age kind of range, the common cold usually isn't a big deal. We don't catch it very often because we have immunity. We have natural immunity that we've acquired over our lifetime. Chromium, another one you really shouldn't even worry about. They mentioned effect on breaking down fat, carbs, and then selenium. Do not take selenium. Okay. The only time you use selenium on the body is Selsun Blue. Selenium is the active ingredient in there, and it's an antifungal. So when patients get like a lot of like dry, dandruff is actually due to fungus. That's actually the most common cause. And so using selenium, or when they get fungal infections on their skin, then you tell them to use Selsun Blue as a body wash, and so, along with other medications that we prescribe, like lotions, creams, stuff like that. But don't take selenium. Just okay. Appetite. So, as far as appetite control goes, hypothalamus is it's the middleman. It's the controller. It is sampling your bloodstream and saying what you need to do or don't need to do. Okay, so hypothalamus is just monitoring everything. It's kind of the brain of the brain, if you will. So if we see like abnormalities here, we could see abnormalities in appetite, either increased or decreased. Um, Certain hormones will act on it. So like CCK, when it's released, because we have food where? When do you release CCK? Where's the food? It's kind of in the notes. Duodenum. So we've entered the duodenum. Food has entered the duodenum. Um, and so we release CCK that causes pancreatic enzymes to release. That causes gallbladder to contract and liver to continue to make bile. Okay. At the same time, it's acting on the brain to tell the brain stop eating. You are full. So one of the habits, like when people, they have like weight problems, is training them to eat slower. Because as you eat slower and things enter into duodenum, it can shut off and tell you you're full. Stomach stretch also plays a role in that. There is feedback from there. So once again, if someone eats a little slower as the stomach stretches, it signals the brain, and eventually they realize I do not need to eat. Leptin, so adipocytes release that, also acting on the thalamus to turn it off. I always remember ghrelin as when my stomach's growling because I'm hungry, ghrelin is active. So ghrelin is going to increase hunger. And then there's peptide YY. Duodenum also generates this, also plays a role in decreasing appetite or hunger. So sometimes there is thought that some of this is defective. But that being said, I don't know if any of you watch My 600-Pound Life. A lot of these, I'll say every single one of them, I'll be bold enough to say that every single one of them, when they talk to them, there is some type of stressor in their past. So they have something they cannot deal with, child abuse, something like that. And so it's psychological compulsion to eat like that. That takes some effort. When you get up to those levels, to maintain body weight, when you talk about like average person, to maintain body weight is between 2,000 to 2,500 calories. For them to maintain that level, you're talking 8 to 12,000 calories, somewhere in that neighborhood, to maintain weight. That is wild. I mean, try to do that. It's very hard to do. It takes effort. Okay. Uh, Whoops. All right. So 2 stages of eating. Absorptive. So it takes up to 4 hours after food enters your mouth for it to completely enter your bloodstream. That's what we're saying. For it to go through the stomach, break it down, proteins, go through duodenum, all the enzymes break it down, enter jejunum and ileum, and absorb it completely. Up to 4 hours. Okay? Post-absorptive state is after that point, and now I'm not eating. So, like, let's say middle of the night, right? So, if nutrition is entering your bloodstream, what is happening to your blood glucose level? It's rising. It is going up. What hormone would the pancreas release? Insulin. Insulin would be released, correct. We're trying to drive the glucose into the cells. Our body wants to maintain a range. Everything's ranges in the body, okay? There's no like, your blood pressure is not 120/80. It is a range, all right? So there is a range of acceptable blood glucose level that your body is trying to maintain. So when we eat and that nutrition is entering into our cells or into our bloodstream, insulin is released so we can drive it into the cells. It can undergo cellular respiration. We can use it to make ATP or store it. Post-absorptive state. So after that 4-hour point, middle of the night, I'm not eating. There is no nutrition entering into my bloodstream. What's happening to my blood glucose level? Goes down. Okay. What hormone would the pancreas release? Glucagon. Glucagon is going to cause you to break down what? Glycogen. You're going to break down glycogen in the liver and your muscles. And you're going to make glucose so you can make ATP. You can maintain blood glucose level. True low blood sugar is rare. People that go into like hypoglycemia is actually rare. I only know of one person that had true hypoglycemia, and she was actually in school with me when I was in high school. That was it. She had to periodically eat, or she would pass out. But it's truly rare. Hangry does not exist. For my wife, it does. She gets hangry. I tell you, you don't feed her every so often, just angry. Just angry. Your body is going to maintain that glucose level. Okay. You can see some hypoglycemia when you talk about like someone that's kind of petite and they're growing still. So in that middle school, high school range, you can see cases of hypoglycemia because they're growing so rapidly. They don't store as much yet. So you can see it in those cases. They typically grow out of it. But as adulthood, hypoglycemia is pretty darn rare. Why are you going to see hypoglycemia? In the hospital setting, you're going to see people come in that are hypoglycemic. Well, let's see if someone can get this one. This is a thinker. They don't actually have hypoglycemic. What are they doing to appear that they have hypoglycemia? Diabetes is going to be is usually excess. They could come in hypoglycemic. What are they doing? What are they taking? Don't overthink it. Insulin. They're injecting too much insulin. So there are cases with diabetics, they overinject. Typically, you see it with lack of patient education. A new diabetic or like a type 2 diabetic that is now taking insulin, they haven't been educated properly on how many units to take. So it comes in like a little vial and you inject certain amount of units from that vial to control your blood glucose level. My wife had a nurse recently inject an entire vial into a patient, thinking that was 1 unit. They almost killed the patient. They were flooding them with glucose to maintain blood glucose levels. They survived, but that is a wild situation. Okay, you'll see it in that situation, and then you see it in Munchausen. Munchausen is people that will feign illness for attention. So like and then there's Munchausen by proxy. There's a big one that you probably watched recently. The girl where her mom made her seem like she was like paralyzed, pulled her teeth, all that. She just got released from prison for killing her mom or being an accomplice in killing her mom. I forget the name of it. Ruby? Is it Ruby something? No. Anyways. But yeah, you'll see situations like that where they're injecting someone around them. They bring them in and, oh, look, they're ill. They just want the attention. It's a psych disorder at that point. So absorptive, they must be the monomers. So they must be a monosaccharide. They must be amino acids. They must be that monoglyceride or just single fatty acid tails to enter. If there is excess, we store. If there's the right amount, we consume it. If there is less, we consume from our reserves. Okay? So absorptive state, like we mentioned, insulin is controlling it because it's driving the glucose into the cells. We must have that for it to enter the cells. So when we release insulin, a couple things go on. If there's excess, we store glycogen. If there is excess fat, we build fat. That's lipogenesis. And if there's excess protein, then we can have the anabolic process of building protein structures. And then post-absorptive state. So here we're in the fasting state. Glucose levels are dropping. We want to maintain it. So this is where glucagon comes out. There is insulin release because we still need to be able to drive that glucose that we're going to have available into the cells, but glucagon is higher. So we break down that stored glycogen. That's glucose. So glycogenolysis. Then we take protein or fat and we turn it into glucose. That's gluconeogenesis. We are building glucose from a non-carb source. And then lipolysis, that is breakdown of fat, also used to make glucose or ATP. So when you watch people like they go to the gym and they lift weights and they're bulking and they want to get bigger, and always right after they're at the gym they're like, I gotta eat. But if you think about it, that doesn't really make too much sense. It takes up to 4 hours to absorb everything. Then it's got to go through the liver. Then it's got to go through your heart. Then it's got to go through your lungs. Then through your heart. Then back out. Then it's got to go into the cell. Then the cell has to decide it wants to use it and build tissue and all of that. Really, their meal from earlier in the day or the previous day is what's used. Consuming it afterwards, having their protein shake afterwards is not doing anything for them after that workout, for that workout. For the next workout, yeah. Okay. Also, what does the body prefer to break down first? Glycogen. So glycogen, that's usually the first. Once you exhaust the glycogen, what do you go for? Everyone thinks fat. It's protein. Your body will dive for protein first. It is easier to break down, easier to use. Then it will go for fat. So they say you have, I think it was the rule of 2. Let me think about that for a second before I say it. 2 hours is glycogen, 2 days is protein. I want to say it takes a week to 2 weeks before you truly start to break down fat. It's a considerable amount of time. So when you see people do like crash diets, for example, and they do like a diet for like a week or two, usually they're just eating the protein. What happens after they get off the diet? They lost all this weight. What happens? They gain it and they gain more. Why? The protein, the muscle isn't there to actively burn nutrients, food. And so it's easier to store as fat at that point. So that's why, like, if you want to diet or something, you have to go quite some time to actually get proper results. All right. So liver, we've talked about all of this, making bile, making cholesterol, getting rid of bilirubin, getting rid of cholesterol in the bile, generating glycogen, okay? Clotting factors, it's necessary for that albumin, which plays a huge role in osmotic. We'll talk about complement and immunity, LDL, HDL, VLDL, IDL. There's a bunch of them. That's our lipoproteins, detoxification. So alcohol, they mentioned acetaminophen here, which is Tylenol, but lots of medications. Lots of medications are metabolized by the liver. So if like the liver isn't functioning properly, the levels of that med will be much higher. Storage of fat-soluble vitamins, so that's KADE, Kade, okay? Iron, because of breakdown of hemoglobin along with the spleen. Breakdown of old red blood cells along with the spleen plays a role in that. And then activation of vitamin D. So the vitamin D that we absorb from the sun, diet, then goes to the liver to be activated. Basal metabolic rate, so we kind of touched on this. That is how many calories you burn just sitting there, not really doing much of anything. So in a day, most people burn about 2,000 calories. You know what boggled my mind that I recently learned? How they decide serving sizes. When you get some food and you look at those nutritional facts and it says one serving size is this much. So like yesterday I bought some almonds. By the way, the blue whatever brand almonds, the smokehouse ones, bomb. And the Korean barbecue ones, bomb. Okay? But on there, a serving size is 28 almonds. What boggled my mind, how do you think they come up with that? They literally give it to a bunch of people and see how much they eat and decide that's how much. It is not like some type of standardized process. So when you look at like sweets and they package it in that format, that's because they give it to people and that's how much they ate at in one sitting. It's kind of wild. Okay. How can you alter BMR, basal metabolic rate? Depending on body size, depending on muscle mass, sex because of like testosterone levels, age because really muscle activity, how much mitochondria you have in your muscles, mitotic activity, all of that is going to alter it. So how can we increase BMR? Exercise, like Natalie said. The more we exercise, especially when you talk about like stamina type exercise, those burnout weightlifting, um, actually creates more muscle mass, more mitochondria in there. You undergo cellular respiration more because you need that energy. The muscle needs more energy at resting. You raise your BMR. So the more you exercise, the more you can eat. Just saying. Okay. Um, you think about like when you were younger, man, when I was in high school, I'm 6'2". I'm currently at 207 pounds. I'm still under BMI levels. But in high school, I was 6'2" and 140, 145 pounds. I could eat whatever I wanted. It didn't matter because my rate of metabolism was very high. I played baseball. I was in gym. We ran all the time. I'd come home and play basketball with my buddy. I was just always active. And because I was growing, mitosis is, increased rapidly. Literally could eat whatever I wanted. I mean, on Fridays, I'd literally at lunch would split a large pizza with a buddy, kill the half pizza, have Surge, Surge. If you don't know what Surge is, you're missing out. They brought it back recently. Or Mountain Dew. It didn't matter. I'd have breakfast. I'd have dinner. I'd have snacks in between. Couldn't gain weight. Just couldn't. And that was my basal metabolic rate was through the roof. One, in part because of activity. Two, because mitotic rate, because I'm growing. Okay. And now the slow decline. I mean, it's kind of wild when you think about it. High school to now, I've gained what, 60 pounds roughly? That's crazy. It's a couple pounds a year and it adds up. Um, so yeah, try to minimize the gain while you're younger. As you get older, it's harder to deal with. So cellular respiration, we talked about this. Make sure you guys know the equation, like with all the numbers and everything. So like the C6H12O6, make sure you know all that. Thyroid plays a role in this. So thyroid hormone affects metabolic rate. When we're younger, there's more activity of thyroid hormone typically because of growth. So the more thyroid you have, the faster your metabolic rate. So hyperthyroidism, which is Graves' disease, it's an autoimmune disorder. They have very fast metabolic rate, fast heart rate. They do not tolerate heat because of the high metabolism, that heat that's coming off cellular respiration. Thyroid eye disease, you may have seen that. That's called exophthalmos. The eyes, because of a protein sugar compound that deposits behind the eyes, their eyes start to come out of their head. You look at them from the side and the eye is far out. They've been advertising it on TV recently because they came out with like a new drug to help reduce that. They get the same deposit around their ankles, very skinny. So you'll see Graves. It can be dangerous because they can go into arrhythmias. So typically what we do is we give them radioactive iodine. It gets absorbed up into the thyroid and kills those active follicles. The downside to that is they develop secondary hypothyroidism due to this. So we got to give them Synthroid. Synthroid is a drug that is dosed in micrograms. Majority of drugs you take are either milligrams or grams. This is micrograms, very precise dosing. Um, it has to be monitored because too much, they could have a heart attack. Too little, they're going to weight gain, sluggish, all of that. There is also an autoimmune version, which is called Hashimoto's. Um, Kind of rarish, but same symptoms: sluggish, weight gain, fine hair, um, cold intolerance. I think that's pretty much it. Okay. So hypothalamus, that's controlling heat production. So for example, when you get sick, why do you get a fever? It's not from the organism necessarily. It could be, but usually what it's from is your own white blood cells. Your white blood cells are releasing pyrogenics. These communicators go through your blood, hit your hypothalamus, and tells your body, turn up the heat. We've got something bad in here that we need to kill. So fever is a good thing. I always have that conversation with students. Fever is a good thing. Up to 103.9 is a low grade fever. It's not something to worry about. Now, if you're going to put a kid to sleep and they've got a 103, 102, yeah, maybe we should be giving some Tylenol. Do you have a comment? Yeah.
The seizures.
Febrile seizures, infantile febrile seizures. It's funny you bring that up. My youngest sister had them. And so in that situation, yes, we should be active, but they grow out of it. A couple of years and they grow out of it. So some children, for some reason, they get a little fever and they start seizing. So the first time, I remember I was young, and I remember the first time it happened with my youngest sister, and I mean, my parents were losing their minds. I mean, your young child, your 1 or 2 year old, starts seizing. Called 911. They came. They gave her a suppository. She had stopped seizing at that point. And that was kind of the end of it. I don't know if we went to the hospital afterwards or the next day, like pediatrician, but we're foreign, so probably next day pediatrician. It's good now. It's good. All right. Um, but yeah, the high grade fever, that's a different story. Now we're going to denature proteins, all of that. Why a suppository? Because suppositories bypass the liver. They actually, as they're absorbed through, they bypass the liver and they immediately enter into bloodstream. So they're much faster acting. So that's the reason for that. Plus, getting a child to like swallow stuff, go through the absorption, all of that takes some time. So suppositories are usually modality of choice for young children. Okay. I know my wife was saying the other day, when she's like, patients at, because she uses Celsius, 38, 39 degrees Celsius. She's like, I don't even bother with the fever. It's fine. Nothing to worry about. It's part of your immune response. Okay. So how do we raise temperature? We pull peripheral blood into the core. By doing so, we don't lose heat through radiation. We don't lose it into the atmosphere. And so our body will do this for as long as it can if it needs to. So say you're trapped out in the cold, your body will pull into your core for as long as it needs to. What's interesting, when they find those people, like they get stuck on the side of a mountain or something out in the cold, they tend to find them naked and dead. And the reason is it pulls in as much as it can, and then eventually you fatigue. You don't have sufficient ATP to constrict the muscles before um, the capillary beds, and then suddenly it'll release it out, and they feel like they're on fire, and so they undress, and then they succumb to hypothermia. Okay. If core temperature is low, we're pulling it in, holding it in. Okay. If it's high, we release it out. That's why, like, we flush. We put the blood near the skin and let the heat come out. So conduction, that's when you're touching a surface. I'm transferring heat from my body to the desk. Convection, that's, we're getting the heat to the surface, and as the air goes over, it feels better. When you put a fan in front of you, that's why it feels so much cooler. You're immediately pulling heat off of your body. Radiation, this typically you're talking about, heat radiating off. Like when you look at a road and you see the shimmering, your body is effectively doing the same thing. Evaporation, we sweat. As we sweat, the water takes heat with it and leaves our body. So one of the worst times, especially growing up in like Florida, for example, high humidity. High humidity is a killer. especially in like elderly and children, because one, they don't sweat very well when you talk about elderly. Two, when there's high humidity, the water doesn't want to evaporate. And so you can't cool down. They end up developing heat stroke. Heat stroke is very, very dangerous. Typically, they end up with issues afterwards, some type of debility. Um, I remember as a kid, our neighbor, he was a landscaper for SeaWorld. Cool guy, very functional, and then he had a heat stroke. He was working, had a heat stroke. And afterwards, he could not speak very much. He was big trouble. Couldn't walk very well. That's it. He was disabled. So, hydrate. That's the moral of the story. Hydrate. Okay. When temperature gets high, we denature protein, we denature enzymes, they do not function. And like I was saying, high humidity and older patients, they really struggle with this to control body temperature. So that's why, like, you'll see, in the winter or summer when some elderly person disappears, they freak out because they're outside. And if it's cold, they can't maintain body temperature too well. If it's really hot out, they can't maintain body temperature too well. So it's, urgent to find them. All right, so we're done with metabolism. We're going to shift to blood. Blood. All right, why is it? Oh, yeah, I need to click here. So the strategy is the further I move us ahead, the more breathing room we have. And then because I've gone over the material, you have more opportunity to study it after it's already been talked about, okay? So that's why I like to move ahead if I can. And because I'm recording it, like, you can go back to it and not feel bad. I don't feel bad about recording it then, okay? Um, so remember, digestive metabolism, that's test one. From here on is test two, okay? So blood is a connective tissue. As far as blood goes, we have cells in there. We're going to talk about red blood cells, the different white blood cells, and then fragments of cells, which are platelets. The matrix or the media it's basically flowing through, plasma. So, purpose of blood. One, it's how we circulate oxygen around. We need the hemoglobin inside the RBCs to carry oxygen to the tissue. We also need it to carry CO2 out of the body, like to the lungs from the tissue to get rid of it. And then immunity, white blood cells. The different white blood cells all have different purposes. We'll talk about each one. And antibodies. We generate antibodies to fight antigens. Antigens are name tags on any foreign substance and even on your own cells. It is a name tag. The only cell that we talk about that does not have an antigen on it is O negative blood type. Everything else has technically an antigen, some type of identifier. O negative blood type has no antigens on it, and that's why they're the universal donor. That's why you can give that blood to anyone. Everything else your body has the ability to identify. Every time you interact with these different antigens, you build an antibody to it, a specific antibody to it. It's the same logic as like enzyme, substrate, lactase, lactose, antibody, specific antigen, okay? Buffers, you have the bicarb buffer system that we looked at with the parietal cells to generate that hydrogen ion to make acid in our stomach. This buffer system controls the blood's pH. That's regulated between 7.35 and 7.45. Completely regulated. That's one of the other biggest gimmicks being sold is alkaline water. After you drink water, what's the first stop?
That was the first stop.
First stop. The first point after you drink water. Where does it go? Mouth, esophagus, and then stomach. What's in your stomach? Acid. A pH of like 1 or 2. Do you think your body cares if your water is 6, 7, 8? Irrelevant. You have acid inside of you. Your body buffers it. Irrelevant. Okay? Um, that's just a huge gimmick that's being sold. That alkaline water, don't waste your money. Okay? Carbonic anhydrase, that's what's doing the conversion of this buffer, and like we said, controls pH. As far as blood goes, total blood volume, it's going to differ person to person. Size of the body, female, male, it alters the volume. So somewhere between 5 to 6 liters. As far as RBCs, somewhere between 4 to 5 million. These ranges are important because if I see a patient that has under 4, now I got to wonder what's going on. Why are they short RBCs? What's going on? Is something destroying them? Is their body not able to make them, like they have leukemia? Or are they making too many? Then we have polycythemia. Too many cells. Their blood becomes viscous. It's thick. It does not want to circulate. They throw clots. Okay? White blood cells. Too low? Ooh. That's usually indicated for like HIV. Too high? Depends on the type of blood type or the white blood cell. It could mean leukemia because they're non-functional, it starts overproducing. It could mean they're fighting a bacterial infection, a viral infection. So we have to look at the differential. You may have had, blood work and your doctor says, I'm going to get a CBC with differential, or you saw it in a movie, whatever. And that's what they're doing. They're looking at the individual cell lineage. That's what the differential means. Okay. It's more viscous than water. It has protein in it. It has cells in it. So by definition, it's going to be a little more viscous. Okay. So blood, when they talk about whole blood, like they're giving whole blood, that is plasma plus cells. Typically, we give red packed blood. So that is just straight RBCs. We get rid of the plasma, spin it out, separate it. In the plasma, if you give fresh frozen plasma, for example, that has clotting factors in it, it has antibodies in it. So depending on what they need to do, they give different things. Right? Hematocrit, so this is looking at how much RBCs are making up the total blood. So hematocrit, more in males because more muscle mass typically. So because there's more muscle mass, there's more demand for oxygen because we're undergoing more cellular respiration. So we need more carrying capacity to provide that. When you spin blood down, so we have erythrocytes, because they're very dense, they typically go to the very bottom. The buffy coat, which is usually seen as fat, that's usually what you're seeing there. Okay. And then up at the top, that's usually the plasma. That's usually, like I said, antibodies, complement, clotting factors, and that's it. I say antibodies, yeah. Okay. So that's why we spin it down to separate it as needed. Yeah. Also, in females, hematocrit is lower because of menstrual cycle. That's the other reason for lowering it. Let's see. So, plasma, colloid just means things are floating in the medium, primarily water, right? Everything is dissolved in it. So all the food that you eat, all the minerals, vitamins, they're all floating in it. Proteins, lipoproteins, all of that is floating through it. You think of this as the subway system in New York. It goes everywhere, right? You have to send it to every borough, every area, so you can get the people going there. It's the same concept with your blood. It has to reach every area to provide nutrition to every part of the body. So what happens if you cut off blood supply to the tissue? You don't have a supply of oxygen or nutrition. What's going to happen to the tissue? It's going to die. How quickly? Depends on the metabolic rate. So a lot of times now, like we're doing, after someone has a heart attack, we'll do targeted temperature therapy. We'll lower their body temperature. By lowering the body temperature, you decrease the metabolic rate. You may have seen that movie where the kid fell in the lake and they revived him after like an hour and he had no deficits. And that's because he was like frozen. That's the only reason that happened. It decreased the metabolic rate, just slows it way down. Right? All right. So proteins floating in there. Albumin. We've talked about them. Who makes albumin? Who makes albumin? We should know this. Come on. It is a protein, but what organ makes albumin? Liver. Liver makes albumin. Okay. Um, Anything that's not water soluble will typically attach to albumin to be transported around. He is the primary player in creating osmotic pressure, that pull of water towards him. Globulins, so these are immunoglobulins. These are protein structures that are your antibodies. And then fibrinogen, he's kind of like a zymogen. He's a precursor. He's not active. He has to be activated, and then he creates clots. So he's floating around your bloodstream inactive. So albumin, like we said, main player in holding pressure. If you do not have appropriate albumin, you develop edema. Edema is water getting into the tissue, so between the blood vessel and the tissue, excess water in there. If you have liver failure, you have cirrhosis, they develop ascites, which is an edema. The big belly, the beer belly, it's just full of fluid. Okay, so huge swelling. You can see it in all parts of the body. Okay, they'll develop varicose veins because of it. The veins are starting to have too much pressure in them. All kinds of issues. So when we have lots of protein, we have lots of osmotic pressure. Water pulls into the vessels. If we lack osmotic pressure, we lack protein, water enters into the tissue, interstitium, or interstitial space, creating swelling, edema. Okay? We develop some edema throughout the day. That is normal. Stand all day, take your socks off. You'll notice like the imprint of your socks on your foot, your leg. That's edema, but that's because of pressure. We've increased pressure because we're standing up all day. That pressure, that water pressure, that's hydrostatic pressure. That is the push out of the vessel. So hydrostatic pressure is pushing out. Oncotic pressure is pulling in. Or osmotic, sorry. I say oncotic because that's the way I learned it. A lot of books refer to it as oncotic because we're saying protein is the main player. Osmotic is when you look at all of them. Sodium plus albumin, whatever other solute. Okay. So if we have too much hydrostatic pressure, too much pressure inside the vessel, we'll override that osmotic or oncotic pressure and create edema. What is something that would increase that water pressure inside your vessels? The blood vessels. Too much sodium. If you have a lot of sodium, you're going to pull more water in there. Think of it like a balloon. The more you expand it, the endothelial cells that make up your blood vessels actually stretch too. The fluid can exit more easily. Anything else? What if I chug a bunch of water? Would I not absorb that water into my bloodstream? Would that not increase the hydrostatic pressure? Yes. What if you put an IV in a patient and you give them fluids until their kidney filters it out and you pee it out? It's in their bloodstream. It will increase hydrostatic pressure. So a lot of times patients, you'll see them sitting in the hospital and they'll start having edema, and we're just giving them a little too much fluids, a little fluid overloaded. Congestive heart failure. Heart isn't pumping, the blood backs up, we develop that increased hydrostatic pressure, edema. Yeah. So as far as the formed elements, so the structures inside your blood, we have red blood cells, they carry oxygen. We have all the different white blood cells that we're going to talk about. So we got basophils, neutrophils, lymphocytes, eosinophils, monocytes. They each play an individual role. What they do, what they deal with is different. Okay. And then platelets. So we had a cell called the megakaryocyte. He fragments, and when he fragments, he creates platelets. Platelets communicate, they still function, but they're not truly a cell because they're pieces of cells. And technically, red blood cells are not cells either. A lot of books will refer to them as red blood corpuscles. So, what happens with a red blood cell when it's immature, it does have a nucleus, and then it generates hemoglobin. After that, in order to have more room for the hemoglobin and so it can hold oxygen, it actually barfs out its own nucleus. So after that, no nucleus, it cannot replicate. Your red blood cells are good for 120 days plus or minus a week. Right? That's roughly what they're good for. I'm going to stop here. We're making good progress. Okay. So my question for you guys is, because we're also, if we have time to do review, we have plenty of time. Do you guys have any questions about the material? Anything you want to go over for the test? Anything we need clarification on?
Said that like protein,
Yes.
but I remember watching the video, and it said
So the question was because I stated like the body after glycogen, the first thing body typically goes for is proteins and then fat. And in the videos, Dr. Schultz's videos, it says fats before proteins. It really should be it should be proteins, but it's fine. If she says that in the video and a question comes, I will honor the video. Okay. Um, so test is Wednesday over digestion and metabolism, 50 questions, 30 multiple choice, 20 short answer. I do not need novels when you answer them. Just be to the point and that's it. Okay? Because what happens is you guys write and you write and you write and then you start writing the wrong answer. You put something in there that's wrong, I got to deduct points at that point and give you partial credit. Just be direct. Makes grading much easier. You get your grades back much quicker. Okay? So don't forget Green Scantron, room 110, 11:30 Wednesday. Monday we meet. We'll continue with blood. So if you have time, work on your lecture notes a little bit. It's, when you're done studying for the test and you're just doing mindless stuff, that's when you work on your lecture notes. Priority though, test material. Okay? Test material. I'm jumping ahead a bit, and we had to because of MLK. But primarily work on test material, and then when you're just exhausted, you're tired, that's when you fill out your lecture notes. Any other questions? Nothing else? We feel comfortable with the material? Ready for the test? Lecture notes are 100% filled out for digestive and metabolism? Not. If you're stuck on something, now's the time to ask.
there's some questions.
Uh-huh.
No,
What do you got?
digestive system. So there are a few questions about carbohydrate absorption. It has a in the enzyme that will catalyze the reaction shown in the program. I really couldn't find that anything.
What's okay? Can I borrow your book? 1 second, so I can answer the question because I don't have. So bottom here. Okay, so for y'all at home, the question is on page 22, and it's about this guy down here, right? So when you look at the image on the right here, right side here, it's saying there's a dipeptide. It wants dipeptidase, generalized. And then name the symporter. It's the sodium amino acid symporter. That's what they're looking for there. Yeah, don't overthink it. Yeah, keep it simple.
The sodium.
It's a sodium amino acid symporter.
Thank you.
They want to see if you recognize that that's the symporter, because the other one that's across from it is an antiporter. Right? You have more questions? Maybe?
I think it's all right.
All right. So remember STEM Center, that's another great resource for you guys to be accessing. It's usually like a former student, someone that's taken the course, or it's Miss White here at the ANF campus, who's the head of STEM Center. So they'll help you. Like I said, getting an open lab helps. You look at the tissues, that helps you learn all the cells, like Peyer's patches. What tissue am I looking at that has Peyer's patches? All right. If there are no other, is it duodenum Peyer's? Ilium. It's the ilium. Duodenum has, what does duodenum have? What's his unique cells? Brunner's. Okay. So work through the material. If you have questions, email me. You're stuck on something, email me. It doesn't mean I'm going to sit and answer every question for you, okay? But if you're really stuck, you can't find it between the videos, my lectures, the PowerPoint, that kind of thing, email me. I will help you, okay? Enjoy your weekend. I will see you guys Monday. Study, study, study. Bye.